Hello everyone, welcome back to Healthy Care. Do you know what to do if you suddenly have a heart attack while you're alone? According to the CDC Centers for Disease Control and Prevention, heart attacks affect 85,000 people each year in the United States. Here's the alarming truth: heart attacks don't wait for the right time or place. They can strike unexpectedly, while you're driving, working, shopping, or even relaxing at home. Now imagine being all by yourself at such a life-threatening moment. Seconds matter, and what you do in those moments could be the difference between surviving or not. Don't panic. In today's video, we'll walk you through straightforward, life-saving steps you can take if you're alone and experiencing a heart attack. Stick with us until the end, give this video a like, and share it widely. This knowledge could save a life, including your own. Cardiovascular diseases don't take holidays. They're relentless. Globally, they remain the #1 cause of death, and the statistics are staggering. According to the American Heart Association, 1 in 5 deaths in the U.S. is caused by heart disease. A heart attack, or myocardial infarction, occurs when a blood clot blocks the flow of oxygen-rich blood to the heart muscle. Without quick action, parts of the heart muscle begin to die, and every passing minute worsens the damage. In an ideal world, help would arrive instantly, but reality is rarely so kind. Heart attacks can happen anywhere, at any moment. So, what should you do if no one is around to assist? In this critical situation, knowing the right steps is your greatest ally. Have you or someone you know ever faced a heart attack while alone? What actions did you take? 1. Recognize the symptoms immediately. The first step to facing a heart attack alone is being able to recognize the signs. While the most classic symptom is intense chest pain described as pressure, tightness, or burning, a heart attack doesn't always present this way. It's essential to watch out for chest pain or pressure lasting more than a few minutes, which may radiate to the left arm, back, neck, jaw, or stomach. Other symptoms include shortness of breath, even while at rest, cold, clammy sweat, dizziness, nausea, or vomiting. Extreme weakness, a sensation of fainting or inexplicable anxiety, pale or grayish skin, or a feeling of impending doom. In the U.S., it's estimated that about 200,000 heart attacks annually occur in people who have already experienced at least one before. Early recognition can prevent more severe damage to the heart. Don't dismiss mild symptoms as just discomfort. If you suspect you're having a heart attack, don't remain in denial. The sooner you accept the seriousness of the situation, the quicker you can act. 2. Call emergency services immediately. Your phone is your lifeline in this critical moment. As soon as you recognize the signs of a heart attack, call 911 or your local emergency number without delay. Clearly and calmly state that you believe you are having a heart attack. Provide essential details such as your address, location, and any relevant landmarks if you're not at home. This information helps emergency responders reach you as quickly as possible. If you're able, put the call on speakerphone. This allows you to follow the dispatcher's instructions while keeping your hands free to take other necessary actions. The dispatcher can guide you through immediate steps to stabilize your condition until help arrives. Never attempt to drive yourself to the hospital. During a heart attack, the risk of fainting or losing consciousness while driving is high, which could result in a dangerous accident, putting both your life and others' lives at risk. Every second matters when it comes to heart health. Emergency medical responders have the training and equipment to start treatment on the spot, ensuring you get life-saving care as quickly as possible. Remember, Calling for help immediately can mean the difference between life and death. 3. Sit or lie down in a comfortable position. Once you've called for help, it's important to minimize the strain on your heart by resting in a safe and comfortable position. Avoid standing or walking, as these actions can further stress your heart and worsen the situation. Instead, sit or lie down as soon as possible. If you're sitting, position yourself so your back is supported, such as against a wall, and keep your head and upper body slightly elevated. Use pillows or cushions, if available, to maintain a 30-45 degree angle. This posture helps improve blood flow and makes breathing easier, reducing the workload on your heart. If lying down is more comfortable, ensure you're in a safe area where you won't fall or hurt yourself further. Keep your upper body elevated similarly to the sitting position, as lying completely flat can sometimes make breathing more difficult for heart attack patients. Stay calm and try to regulate your breathing with slow, deep breaths. Avoid unnecessary movements, as conserving energy is crucial. Remember, your goal is to keep your heart under as little strain as possible while you wait for emergency medical responders to arrive. Every moment of rest can help your heart function more efficiently during this critical time. 4. If aspirin is available, consider taking it. Aspirin, often overlooked as a common medication, can play a critical role during a heart attack. It acts as a mild blood thinner, helping to slow the formation of new blood clots and preventing existing clots from growing larger. This effect can reduce the damage to the heart and buy precious time until medical help arrives. If you suspect you're having a heart attack and aspirin is within reach, chew a regular strength tablet about 300 mg rather than swallowing it whole. Chewing accelerates absorption through the mucous membranes in your mouth, allowing the aspirin to act more quickly. However, only take aspirin if you are not allergic to it, and if your doctor has previously advised you to use it in emergency situations like this. If you're unsure whether taking aspirin is safe for you, focus on calling emergency services first. Never put yourself at risk by searching for aspirin in hard-to-reach places or rummaging through cabinets, as this could exacerbate your condition. Remember, the priority is your safety and conserving your energy while waiting for professional medical assistance. 5. Control your breathing and try to stay calm. Remaining calm during a heart attack is easier said than done, but it's one of the most important things you can do to help your heart. Panic triggers the release of stress hormones like adrenaline, which can increase your heart rate and blood pressure. 2 things you want to avoid at this critical moment. Focus on controlling your breathing with slow, deep breaths. Inhale deeply through your nose for a count of 3, hold the breath briefly, and then exhale slowly through your mouth. This simple breathing technique helps lower your stress levels and allows your body to use oxygen more efficiently. The American Heart Association underscores the importance of reducing stress during a heart attack, as it can prevent further strain on the heart. To maintain mental composure, try techniques such as focusing on a specific object in your surroundings, or repeating a calming phrase in your mind, like "stay calm" or "help is on the way." Visualizing a serene scene, such as a quiet beach or a peaceful forest, can also redirect your mind away from the fear and help you relax. These small mental shifts can make a big difference in helping your heart stay stable while you wait for medical help. 6. Avoid unnecessary effort. One of the most critical things to remember during a heart attack is to conserve your energy. Any physical exertion, even something as simple as standing up to retrieve an object, can place additional stress on your heart, which is already struggling to function properly. Avoid climbing stairs, bending down, or moving unnecessarily. These actions demand more oxygen and energy from your body, which can worsen your condition. If you're in a potentially dangerous location, such as in the shower or outdoors, move slowly and cautiously to a safer spot, but only if absolutely necessary. For example, if you're near a hard surface where falling could cause injury, shift to a safer position like sitting on the floor or leaning against a stable structure. Once you're in a secure spot, remain as still as possible. Remember, your heart needs to work as little as possible until help arrives. Every movement counts, so prioritize resting in a comfortable position to minimize strain on your heart. By conserving your energy and staying still, you're giving your body the best chance to manage the situation while waiting for professional medical intervention. 7. If possible, loosen tight clothing. During a heart attack, removing anything restrictive can significantly improve your comfort and breathing. Tight clothing like ties, collars, belts, or bras can hinder blood circulation and make it harder to breathe, placing extra strain on your heart. Loosen these items gently, starting with anything around your neck or chest, such as ties or bras, followed by waistbands or belts. By easing these restrictions, you allow better airflow, reduce the feeling of suffocation, and help your body oxygenate more efficiently. This not only alleviates physical discomfort but also lowers anxiety, helping you stay calmer. Small adjustments like this can make a big difference, but avoid unnecessary movement. Only loosen clothing if it doesn't require significant effort. Your goal is to conserve energy while waiting for medical help. 8. Do not eat or drink anything. During a heart attack, avoid consuming food or beverages unless specifically instructed by emergency responders. Drinking water or eating something could increase the risk of choking if you begin to feel nauseous or start vomiting. The fewer variables you introduce to the situation, the better. Your priority is to stay conscious, breathe steadily, and wait for the ambulance or medical assistance to arrive. 9. Monitor your symptoms and stay alert. During a heart attack, staying as aware and focused as possible is critical to managing the situation effectively. While it's undoubtedly challenging to concentrate amid the pain and fear, paying attention to your symptoms can provide valuable information for medical responders. Note the intensity of your pain and whether it's worsening or radiating to other areas, such as the shoulders, arms, neck, or jaw. Additionally, monitor for any numbness, tingling, or loss of sensation in your limbs, as these signs may indicate compromised blood flow. Remaining conscious is crucial. If you feel lightheaded or sense that you may faint, try to position yourself in a way that minimizes the risk of injury. For example, lie down on your side with a cushion or soft surface nearby to reduce the chance of harm if you lose consciousness. This position can also help maintain blood flow to vital organs. Avoid abrupt movements, as they can strain your heart further. By staying alert and collecting mental notes about your symptoms, you're equipping emergency responders with the insights they need to provide prompt and effective care. Even in such a high-pressure situation, your efforts to remain composed can make a significant difference in the outcome. 10. Plan for the future. Heart attacks can seem sudden, but preparation can make all the difference in managing your risk and improving outcomes. Start by addressing common risk factors such as high blood pressure, high cholesterol, diabetes, smoking, and obesity. Consult your doctor about personalized strategies to manage these risks and ask for clear instructions on what to do in an emergency. To ensure you're always ready, keep your phone fully charged and save emergency numbers like 911 or local ambulance services in an easily accessible contact list. Familiarize yourself with the quickest routes to nearby hospitals and let trusted friends or family members know about your condition so they can assist if needed. Consider creating an emergency kit with essentials like aspirin, nitroglycerin if prescribed, and a list of medications and medical history. Keep this kit in easily accessible locations, such as beside your bed or in your car. A medical alert bracelet or card detailing your health conditions can also provide critical information to responders if you're unable to communicate. By taking these simple yet effective steps, you can reduce your vulnerability, feel more in control, and face potential emergencies with greater confidence and preparedness. Caring for your heart isn't just about what to do during a heart attack. It's about building habits that keep your heart strong and healthy every day. Regular medical checkups, eating a balanced diet, staying active, reducing alcohol intake, and quitting smoking are all essential. Small, consistent changes to your lifestyle can dramatically lower your risk of future complications. Prevention is always the best approach when it comes to your heart. In the United States, many health initiatives aim to promote heart-friendly habits. These include maintaining a healthy weight, cutting back on salt, sugar, and saturated fats, and incorporating regular physical activity. Keeping your arteries clear of fatty plaques and blood clots starts with what you eat and how you move. The American Heart Association recommends at least 150 minutes of moderate exercise each week paired with a nutrient-rich diet of fruits, vegetables, whole grains, and lean proteins. Managing stress and prioritizing quality sleep are also powerful ways to support your heart. It's equally important to recognize early warning signs. Symptoms like unexplained fatigue, irregular heartbeats, or chest discomfort should never be ignored. Addressing high blood pressure or cholesterol early can significantly reduce the likelihood of facing a heart attack. Remember, these lifestyle tips complement, not replace, emergency medical care. If a heart attack strikes, immediate action is critical. We'd love to hear from you. Were these tips new to you? Do you have other advice or personal experiences to share? Drop a comment below and help others stay informed and prepared. Information truly saves lives. If you found this video from Healthy Care helpful, type yes in the comments and share it with your loved ones. Don't forget to hit the like button, subscribe to Healthy Care, and check out the videos we've handpicked for you at the end. Thank you for watching, and here's to a healthier future.